everyone, I'm Maria. I'm the lead specialist nurse working here in Vascular Access Unit. It is my pleasure to welcome you to this film. The Vascular Access Unit is located on level 4 at the outpatient end of the hospital above the ultrasound department. You can take the lift or stairs from the X-ray department on level 2 or from the ultrasound department on level 3 to get to the Vascular Access Unit. You may be given an appointment from your specialist team looking after you to attend the Vascular Access Unit for the line insertion procedure. This normally means you will be at your appointment for the whole morning or afternoon. The line you will have inserted could include a PICC line, Hickman Line, a Port-a-cath or a Niagara Line.
The peripherally inserted central catheter, or PICC line for short, is a thin, flexible tube that is placed into your upper arm above your elbow. It allows easier access for blood samples and infusions. This should make your treatment more comfortable, as your treating team will not require to use needles on you as often. The PICC line is placed under local anesthetic using an ultrasound machine. You can eat and drink normally before your PICC line insertion, and you do not need to stop your blood thinning medications. When in place, the line is held with a securement device and dressing. The dressing will require weekly changing, and the line will need flushing to ensure it works correctly. Your medical team will arrange this with you. You can perform your normal activities with a line in place. However, you should avoid swimming. It is also important that the dressing over your PICC stays clean, dry, and unbroken. It should be covered with a waterproof sleeve when bathing or showering. The PICC line can stay in place for as long as you need it. Once no longer required, the line will be removed by your nurse with no further follow-up from the Vascular Access team.
A Hickman line is a soft hollow tube inserted into a large blood vessel through a small opening in your chest area. It is used for long-term access to your veins and can be used to give all your intravenous medications and blood sampling. This should make your treatment more comfortable, as your treating team will not be required to insert cannulas at every appointment. If you would like to be sedated for the line insertion, you will need somebody to take you home after the procedure, and you will not be allowed to drive for 24 hours. You are allowed to have a light breakfast and can drink as normal prior to the line placement. You will also be required to have a blood test and stop taking your blood thinning medications before the line insertion procedure, which your medical team will advise you on. The Hickman line is held in place by a small cuff and a dressing. The dressing will require weekly changing, and the line will need flushing with saline to ensure it works correctly. Your medical team will arrange this for you. Once the line has been placed, it is important to keep it clean and dry. Please ensure you direct the shower away from the line when bathing or showering, and that you should avoid swimming with the line in place. The plastic clamps on the line must remain closed, and you should avoid sharp objects or razors near your line. Your Hickman line can stay in place for as long as you need it. Once no longer needed, an appointment will be arranged for you to come back to the Vascular Access Unit to get it removed.
A Port-a-cath is made up of two parts. The first one is called the catheter, which is a thin, hollow tube attached to the second piece called the port. The port is a small metal chamber implanted underneath the skin in the chest area. When in place, you may therefore notice a small bump under your skin. A special needle can be inserted through your skin and into the port to enable your treatment. Most patients have their line inserted as a day case under local anaesthetic and intravenous sedation. If having sedation is your preferred option, you will need someone to take you home after the procedure, and you will not be allowed to drive for 24 hours. You can eat and drink as normal, however you should only have a light breakfast prior to your line insertion. You will also require blood to be taken and stop taking your blood thinning medication before the procedure, which your medical team will advise you on. A Port-a-cath requires very minimal care and maintenance. Once the scars have healed, you can bath and swim and get the area wet. The port will need flushing once a month with saline, and your specialist team will arrange this for you. The Port-a-cath can stay in for a number of months and even years. Once the line is no longer needed, an appointment will be arranged for you to come back to the vascular access unit to get it removed.
A Niagara line, sometimes called a temporary central line, is a soft and flexible tube placed in the blood vessel in your neck. It can be used to collect stem cells, give medications, blood products, and take blood samples. It is placed under local anaesthetic using an ultrasound machine to make the procedure more comfortable for you. You can eat and drink normally before the Niagara line insertion. The line is held in place with stitches and covered with dressing, which should be kept as dry as possible. The plastic clamps on the line must remain closed, and you should avoid any sharp objects or razors near your line. You will be given contact numbers to call if you experience any issues with your line. Your Niagara line will stay in your neck for a few days whilst you receive your treatment. After the treatment, the line will be removed by the nurse that's looking after you.
Your central line can sometimes become blocked or infected, so it is important to check the exit side every day for redness, discharge, swelling or other signs of infection, such as a raised temperature. Thank you for watching. If you have any further questions or concerns with regards to your central line, please contact your specialist team.